Dr. Andrew Brown has extensive in-country experience working with international and national stakeholders to strengthen human resource management systems to effectively develop, recruit, retain, and support the health workforce for increased access to quality health services. He has 20 years of experience in pharmaceutical health systems with a specialized focus on human resources development. Ladies and gentlemen, please welcome Dr. Andrew Brown.
Thank you very much. It's a pleasure to have been given an invitation to come to the SAPICS conference this year. And what's been exciting is there's been a number of sessions to do with public health supply chains, and particularly about the development of human resources in those supply chains. I am the workforce development specialist within the USAID Global Health Supply Chain Procurement Supply Management Project. And what I would like to do is to share with you today some of the insights that we have been experiencing that I think build on a number of the messages we've been hearing from ASCM and also from SAPICS. So I'm very pleased that you can come on this journey together. As you look at the screen, I've put these in red because they're issues. Put your hand up if in your organization you experience one of these issues. If this is something that concerns you with your human resources. Okay, a couple of hands. Now you can be honest. Okay? Now you can just put your hand up because you're cold and you need some exercise. Okay, so whether you're in the private sector or whether you're in the public sector, the issues to do with people are real. And I often say, if you're in with a group of donors, and we might want to ask the question, who would like to invest in drones? Hand up. Who would like to buy the necessary products that will help the patients? Who would like to now invest in the people? I'm sorry, who would like to invest in the people? There are very few, and we want to talk a little bit about that issue. This is just I want to introduce to you a couple of concepts. One, how can we analyze workforce systems in organizations? I want to share with you some work that we've been doing with a global advocacy group called People That Deliver. And I want to also share with you some new work where we're looking at countries as a workforce system and introduce to you the concept of supply chain labor market analysis as a way of understanding a particular country context and looking at areas where we can stimulate or catalyze the human resources marketplace, and finish off with a couple of little snippets from some countries we work in together. What should shock you is that 1/3 of the world's population do not have access to life-saving medicines. 1, 2, 3. So your niece that's got pneumonia, I'm sorry, there's no medicine for that. 1, 2. Your grandmother who's just got malaria, she will probably die because we can't get her medicine, etc. 1 in 3 globally, and this availability is even worse in sub-Saharan Africa. We're familiar with the SDGs, these development goals, and we know that these are community-based. One of the things that we need to be telling the message of more clearly to governments is that the health development goals will not be achieved unless the health supply chains are strong enough to provide the commodities at the facilities to get them there. I'm trying to give you a feel about the need. But what are we talking about when it comes to health supply chains? Let's try this video with some sound and see how we go.
Get health products from where they are made to the person who needs them. A vaccine to immunize a child, a rapid test kit to test a sick patient for malaria, and the medicines to treat her if she tests positive. Contraceptives for women and families, so that this child, this woman, this family are happy and healthy. The process of getting health products to people involves many people working together on various activities at different points along the way. A health program manager to estimate the number of products needed to treat patients. A central medical store clerk who picks and packs products. A driver from a transport company who delivers products to health facilities. Supervisors who make sure staff with logistics responsibilities are supported in doing their jobs. Pharmacists and other health personnel who dispense products. Community health workers who provide products to people at the last mile. A public health supply chain also includes funders, manufacturers, distributors, procurement agents, and private sector partners. This great variety of people and organizations become connected from the top to the bottom of the supply chain. They agree to work together towards a common goal, understanding the role each of them plays in getting products to people. They share and use information about demand, need, inventory, and transportation, so their activities are coordinated and all supply chain partners perform well. An integrated supply chain is strong from end to end, yet has to be flexible and dynamic to adapt and respond to unanticipated changes or challenges in the environment. This end-to-end integration has transformed the way commercial companies like Apple, Procter & Gamble, and Walmart operate their supply chains, helping them to deliver quality products on time and securely to customers, and greatly enhancing those companies' market share and bottom line. Integrated supply chains can be as transformative in public health as they have been in the commercial sector, delivering health products to people when and where they need them, and greatly improving customer service and health outcomes. Improving health is the bottom line for public health supply chains. Lessons from the commercial sector teach us that integration is more than merging health programs. For example, putting malaria and AIDS products on the same truck, or offering family planning and immunization at the same site. Deciding which products to manage together is only one piece of the integration puzzle. Strengthening the supply chain from the very top to the bottom is another. It requires linking people, information, and activities from where products are made to the people who need them. A strong, integrated supply chain delivers health products to the child, family, and community whenever and wherever they need them.
For those of you who are cold, this is where you dance in order to warm up a little bit. So that particular video was hopefully showed you a couple of things. One gives you an overall landscape about the public health space just in a couple of minutes. But also, if we just solve the people problem, that's not going to be sufficient. Supply chains are complex. There are processes, there is information, and there are people. But for today, I want to focus on the people. I'd like to acknowledge in the audience the Executive Director of People That Deliver, Dominique. This is an advocacy organisation that represents over 80 organisations globally interested in improving the professionalisation and systematic approach to workforce in health supply chains. On the screen, each of those blue boxes indicates some of the issues that we're experiencing in our particular sector. And from my interaction with private sector health companies, there is also similar issues with regard to not only a lack of job descriptions and training, but the systems required in order to support workforce. This is some work from Gavi, which is one of the global vaccine initiatives from 2010. And their research at that time noted a 24-fold expected increase in the value of vaccines, but a 5-fold increase in the workload for vaccines. We could do similar analysis of the non-communicable disease space. So we're seeing diseases around hypertension, diabetes, and cancer for which more health commodities will be required. We've seen an increased push to universal health coverage. The package of health services chosen by our country will also determine the range of products that are going to be needed, and these are going to put increased pressure on already fragile systems. At the moment, we have, in many countries, underqualified, disempowered people, poorly managed supply chains, and wasted resources. And a lot of this is because we haven't thought about human resources in a systematic fashion. Has anyone seen this particular report that came out in 2017? People who I've shared it with? Great. This World Bank report is very interesting. The Kuna Logistics University was commissioned by the World Bank to do a global competency analysis of supply chain. And it's an interesting read because all sectors that involve the movement of goods and also services, but mainly goods, have a lack of professionals in supply chain, whether it's skilled drivers all the way up to particular managers. So the issue to do with a lack of competent workforce in supply chain is global and is across industries. And so within our sector, we understand if we are only focusing on the health space, then we're perhaps missing an opportunity to help with the bigger picture. And I want to come back to that particular point. Before I move on to speaking about some of the solutions we're working on, I want to just take a couple of slides to introduce the USAID project that I'm working within. We call it GHSC PSM for short. The Global Health Supply Chain is an overall program of approximately 7 different projects, and this particular project is one of those. The countries on the screen are the countries we work. And the whole focus is on getting commodities available in countries to the most vulnerable to save lives. The program is really focused on the programmatic areas that you see on the screen that are part of the most significant morbidity and mortality in these low to middle income countries, particularly around HIV/AIDS, malaria, maternal and child health, family planning services. And we seek to address this issue with 3 particular ways. One is the purchase of pharmaceuticals using USAID funds, taxpayers' money from the United States. Thank you, Mr. Trump. And this particular purchase of pharmaceuticals is the largest area. So we have a global supply chain that looks at that. We also have a second priority, which is working with countries in order to improve the resilience and the maturity of those supply chains through interventions with governments being conscious of their local priorities in order to improve their systems. And this is a technical assistance arm. And then the third thing that we do is that we work with international partners in order to improve global coordination regarding the investments in improving supply chains. So I just want to share that with you, just to give you the picture of the project. It's a very large project, and you can look online where we have quarterly reports and annual reports. But let's come back to this human resources issue. So this is the paradigm that if we had this, I would be able to spend more time with my family and less time traveling to countries and doing things. What are we trying to achieve? Wouldn't it be great if we had an ecosystem within our organizations, but more so in our countries, where qualified staff were actually contracted for supply chain positions, where there were career incentives for those people to stay within organizations, where there was this high satisfaction and low staff turnover, and actually people came out of high school going, I would really like a supply chain job. That those jobs were seen as relevant and people aspired to them. And this was balanced by the fact that there were national institutions that had high quality programs that produced professionals that were required and ready for industry. The issue with human resources systems is they take some time to change and develop. It's not a short-term 1-year fix. It's not a 2-year fix. It's often a 5 to 10-year fix if you're changing a government system. We understand that private sector organisations are more nimble and can do this a little bit more quickly, but it requires often significant reforms over time, and in the development space, it requires a coordination of a number of partners, particularly with the overlapping of projects. So a couple of significant things that have come out recently. So some of you may have come across an approach called theory of change. Theory of change is where we look at a complex problem, we engage with the people and the different sections of that problem to look at what are all of the components that are contributing to that particular ecosystem. So on the screen is about human resources. And what are the pathways that contribute to an ultimate outcome we're trying to achieve? So here, we're trying to achieve work performance that is optimized. Ultimately, at the top of this theory of change, you can see that we would love to have health outcomes are improved in a particular country by an organization. But as we noted from the little movie, workforce is only part of that bigger picture. You need the infrastructure, you need the systems and the design. So this is the workforce component. The bit we have control over is optimizing the workforce. And through significant in-country research and collaboration, we've come up with this theory of change through People That Deliver that tells us there are 4 pathways that must be active in any organisation to have an optimised workforce. These pathways are staffing, skills, working conditions, and motivation. If we're just working on skills, we're only looking at part of the problem. If we're only working on staff motivation, we're only looking at part of the problem. And for each of those pathways, there are a number of elements that contribute to the pathway that need to be present. So the statement at the bottom shows that they are also interrelated. Skills are essential to workforce performance and may be fostered by training. However, skills alone are insufficient to meet the long-term outcome, particularly if working conditions are suboptimal or if supply chain positions do not have the adequate staffing. So you can go onto the website for People That Deliver. These tools are open access, and there is a comprehensive explanation of these pathways, the indicators that you can use to measure how effective these pathways are at the moment, and you can use that in order to develop a plan of action to improve. Very shortly, in the next couple of months, we will have produced a quick reference tool that you can use yourself in your organisation or governments in their environments to use quick yes-no indicators across the theory of change components to see where you were strong and where you were weak, and so how you can plan to improve. And that's a sort of a little takeaway that you can actually use in your organisation. So we're applying this in a range of countries as part of our project. I forgot to mention that we are working actively in 33 countries for the purpose of strengthening systems, and 66 countries for providing medicines. So as we think about human resources systems, they also need to improve. And on the screen is an adaptive model that tries to explain how systems need to mature over time to get to this high-performing team environment. And it's about ensuring that those 4 different pathways are also maturing over time. There's no point having a very skilled workforce unless there are supporting structures to manage motivation, to both reward good performance and to correct bad behaviour, as an example. And this is a particular approach that we're applying in our countries in our project as a way of trying to pinpoint where we should be putting our efforts for capacity development. So up to this point, in terms of solutions, I was talking about the theory of change for human resources in supply chain management. It had been developed in the public sector space, but we also involved a number of inputs from private sector. And I've also spent 10 years working in the pharmaceutical sector in Australia. And from my own experience, I think that is a tool that can be very appropriately applied in those organisations. But looking at human resources in the confines of one organisation is not sufficient, because it's a whole ecosystem in a country or in an economic region that determines the market for a human resource. So think about supply and demand, and let's apply that to human resources. The demand is, what are you in your organisations demanding in terms of the people, their qualifications, and the quantities you require for supply chain positions? If you're asking for underqualified people with inappropriate qualifications, that's what you're going to get. And when we're working with governments, one of the questions we're asking are, what are the competencies you require your employees to have? And actually, when you look at the job descriptions and who you're employing, is there actually a match? Often we go on cultural norms over time. So for example, there's no doubt that pharmacists need to be involved in supply chains. I'm a pharmacist. But they also need to work together with supply chain professionals as a team to have well-functioning systems. And this is something that we're maturing with in our system. So are we demanding the right people? But there's no point wanting supply chain professionals when they don't exist. So at the same time, you need to understand supply. Supply comes from professional credentialing as well as from academic environments, from universities and colleges, depending on the cadre or the level of supply chain professional you're looking for. So how can we look at a particular environment and understand supply and demand? And more importantly, with that information, what can we do to move the needle, as it were, or catalyse a supply chain labour market to make improvements? We've started this work in Rwanda, where we are thinking about systems actors. So systems actors are those that really legislate the environment. So professional bodies, Ministry of Labour, also the Ministry of Education, Ministry of Finance, Ministry of Health in this situation as well. These create the environment within which the ecosystem of human resources will be growing or not growing, depending on the decisions made. And then we need to look at functional actors, those working day to day. And so in Rwanda, we had a range of interviews with both private sector organisations and public sector organisations in health and fast-moving goods in order to get the understanding of the marketplace. And those results, again, we're going to publish shortly. But what was interesting is that the overall deficit of supply chain cadres, particularly people with the skills of mid-level management, was equally a problem across private sector and public, but not just in health, but across the whole supply chain community. That there was really a strong focus that what the academic institutions were providing was perhaps not meeting the needs of the marketplace, and also a realisation that at that mid-level, which is often the operational staff, if you're in the health system at that district level, or your zone or regional supply chain managers, the companies in Rwanda were having real difficulty in that, and they couldn't see a way out of that and how to move forward. On the other hand, when we speak to universities by themselves, we see that there is an opportunity for them to create courses. They have an interest in this area, but are not quite sure that there is a market for their product. When we speak with professional regulators, we can say, yep, there is a space to make professionals, and we can define that if that's what the community want. So in other words, we can have a situation where the elements for trying to construct a professional environment exist, but the catalyst is not there to create and improve that environment. So this is what we're looking to explore. Out of interest, this is a map of what we found, and I think you'll find this particularly interesting. This is a map of the supply chain space in Rwanda. So at the top you have the ports where goods come in, and clearance and bonded warehouses. You're familiar with that. But then legislation clearly defines there is a health supply chain, and the legislation in the country said that only pharmacists can operate the health supply chain with products. And then you have other commodities. In the middle, you have 3PL, 4PLs, UN agencies, and humanitarian and development agencies that work in both supply chain environments. And in the health circle, there is a clear distinction between public and private, but there is some overlap depending on contracts and distributions. On the left-hand side, right-hand side, we have the ministries and health professional councils, and on the other side, we have education institutions. This is the landscape or the ecosystem that we were seeking to explore. One of the exciting things that's come out of this particular study is we recognise that there is a need for some standard discussion or a catalyst that would help the demand side, so whether it's government or private sector, to articulate what supply chain professionals they wanted, at what level, and what competencies they would need. And you can imagine that such a professional framework would also assist the academic institutions to be able to look at that same framework and say, these are the competencies that we need to educate for in order to meet the need of industry. So we're doing some great work with some consultants through PSM, and I'd like to acknowledge Richard and Andrew who are working with us. We're doing some work to explore whether we can provide a professional framework that countries can implement to bring these actors together and to articulate what a professional framework would look like, so that may catalyse the marketplace to both improve supply and improve demand by working on those different increments together. So the whole of labour market approach is thinking about a whole ecosystem of people as a commodity and how we can understand that labour market and then catalyse investments and coordination to boost the marketplace. So watch this space. We'll have a technical report on this out in the next few months. And then we are working with the Government of Rwanda over the next couple of years to move this agenda forward. Quite an exciting and innovative approach. I now want to go on and just highlight a couple of case studies from within our project. For each of these case studies, I've provided a little bit of context and input, but it's been our in-country teams working with the country governments that are a real on-the-ground workforce behind these. And I just want to acknowledge both the Ministries of Health, the in-country USAID teams, as well as our in-country project teams that have done a lot of work here. So Burkina Faso is an interesting situation where they have re-planned and defined their LMIS system for health. And they quickly acknowledged that in order to ensure sustainability, one of the words you may hear through USAID is this journey of self-reliance, that as we work with countries, we are looking to graduate them from the need for development funding. So in Burkina Faso, one of the elements here is they've designed an LMIS system. There's an understanding that staff both in the system and those in the future need to be educated on this. So this particular activity involved working with the ministry, with academia, with practitioners in order to articulate a curriculum that supported the LMIS system, to instill that into various academic institutions with appropriate training for the different cadres that support this system in the government. So now that that's been institutionalised, then as they're rolling out the system and as new generations of employees come into the marketplace, they have those skills. So obviously, there are other supply chain competencies that are around this, but the focus of this activity was looking at that aspect. And to give a bit of a timeline, this particular activity has taken 3 years to implement. Working with academic institutions and timelines for curriculum review are quite significant. So you need to keep in mind workforce investments need to be over the medium to longer term to make change happen. Malawi has been a very interesting case and one that I've had several visits to be involved in. In this situation, the government had a clear knowledge that their current supportive supervision system was inadequate for what they wanted to achieve. They knew they had keen people, but their people need to be directed and their skills improved, but in a way that helped them to apply those skills to their specific work environments. So this was a great collaboration between the ministry, between our project, and with some external thinking, where they were able to articulate some of the current best practice approaches for monitoring and supervision, and have gone through a process of working together to co-create this new approach, to train the district supervisors in how to use this approach, accredit those supervisors, and now have integrated this into the system. And there's a big push now for data. Andrew, how can you show that these investments are making change? So in this particular activity, we use a monitoring and evaluation team, which I'll talk to from here. So a couple of steps that we did was, one, developed a monitoring tool that went into facilities and on some key indicators, process indicators and outcome indicators for stock availability, gave us a picture of how well that particular facility was performing. That data came back to a regional level, was analysed, and particular facilities that were doing very well and those that were doing quite poorly were identified from that data, such that the district pharmacists could then have an informed decision about where to put their limited supportive supervision dollars needed for the transport and needed for the other costs associated to get to some of these often remote facilities. But then in preparation for their visit, they could prepare with a range of tools. We provide them a range of tools with what we call some knowledge nuggets, very simple job aids to help describe processes, also some skills development activities that could be conducted in the workplace, as well as other job aids. So they had a toolkit. And as they looked at the data, they can not only assess which of their facilities need attention, but at those facilities, which particular supply chain competency areas need a focus. So now when they go and do their supportive supervision, the data is separate from the supportive supervision, they can have an informed discussion with their couple of hours at the facility to look at improving those shortcomings. What's then we can show with the data is that every 3 months we'll be doing this data collection and we can show improvement in those facilities against the indicators we're tracking. So this is where we are showing data against what we're doing. So this is quite exciting for us. One of the, so we've got this new framework, the tools and the supports. One of the other things we did a bit differently was to take the time to develop the soft skills. One of the things in supply chain, which I've seen in a number of countries, is that supply chain personnel and professionals are technically very good, particularly when they've had the training. But often we don't take the time to develop the soft skills of leadership, change management. I'm not sure if anyone followed Garfield, the cat? There's one famous Garfield comic where Garfield is standing next to a professor, right? And I'm Garfield here, and there is a large caption at the top to say, "I learn by osmosis." So for those of you who are not familiar with the term osmosis, it's the flowing of, in this case we'll say information from someone who is very knowledgeable automatically to me. So if I stand here, I'll get knowledge. But that's not how knowledge transfer works. And if we are expecting our staff to automatically supervise staff and transfer skills, then that's an inappropriate understanding of human behavior. We need to train staff to be able to transfer skills and interact with others to improve their performance. I did get a lot of good knowledge, actually, from you. Oh, it's excellent. So the soft skills. But then we didn't just give a certificate for turning up to the course. The district pharmacists were only certified when they could demonstrate they could use those skills in the workplace, and where our team did independent verification at a couple of different facilities in their district to see that the documentation was followed, and we interviewed the staff member at the facility to see what happened. And this was a very work-integrated environment in order to be able to clearly demonstrate that there'd been some improvement in the behaviour of those particular staff members. And as a project, we're putting the final touches to make these particular resources available to everyone, and we'll be publishing these shortly, again, on our website, if you're interested in seeing the detail of the tools behind this particular initiative. And again, just in summary, it's interesting, who knows the Where's Wally? This is my Where's Wally photo. You know, I stick out sometimes, particularly without the hat. So, in summary, a framework has these 4 steps. There's the steps about this M&E monitoring. There's the steps about the supportive supervision, which is informed by data and an informed approach to using your time at the facility. There's the undertaking of the site visit, but there's also that follow-up, and we've introduced a mechanism in the facility that records the supervisory visit so that if other senior staff from other parts of the ministry are coming through, they can also follow up. So we get that continuity of supervision over time. One of the most interesting activities we've been undertaking is in Mozambique. One of the things to observe in a number of low to middle income countries is that the system for pharmaceutical supply has grown out of the initial colonial way that those systems developed, and that is develop hospitals, the pharmacist is in the hospitals provide the pharmacy supplies. So it's interesting, if you look at countries like Australia, America, United Kingdom, and other high-income economies, their health supply chains have developed. So the pharmacists have a clear role for quality control in those environments, but the particular professionals who do the supply chain skills day-to-day or run the warehouses are actually supply chain logistics professionals with support of a pharmacist. In a lot of the countries that we work that are low and middle income, the pharmacists are the predominant cadre working in the supply chain. And that's okay, but they need to have the skills to do that properly. And sometimes we find there's a mismatch between the undergraduate training of a pharmacist and what's expected of them in the workplace. I'll give you an example from Indonesia, where there's 144 building blocks of education in their pharmacist education system. But of that, there are only 4 building blocks for supply chain. When they graduate, 75% of the graduates go into jobs that are 100% supply chain. Can anyone see the problem with that maths? The pharmacists are not being educated with the competencies for the job that they're entitled to. And this mismatch appears in different environments. Having said that, there is a lot of good examples, Nigeria is one, where pharmacists who are interested in supply chain have gained extra credentials in order to get the skills they need. And there's a great white paper that was published. I co-chaired the committee from the International Pharmaceutical Federation that actually maps out the role of pharmacists in health supply chains and about that partnership model and about how pharmacists as medicines experts can be working with supply chain experts for a good functioning supply chain. But that's an aside. One of the aspects in Mozambique is they recognised as part of their review process for their strategy for their supply chain that one of the deficiencies was human resources. And there was a need in order to professionalise the workforce, to get greater skills, to improve productivity, because the staff they had didn't have the competencies required to do the job, particularly as they looked at the inflows of those staff and who they were asking to do those jobs. So USAID supported a range of projects over a number of years to work with the government to assess that situation and to look at plans moving forward. And there was something that's called the PELF, which is basically the Human Resources Strategic Plan in that particular context. One of the interesting things, these are just a couple of pictures from some of the site visits in different environments there in Mozambique. What's interesting about this case study is look at the top date and look at the bottom date. What do you notice? 1 year? 2 years? We've been working through a range of projects over 7 and 8 year period to go from a situation where the government was really interested in professionalising the workforce. And you'll see listed there a number of different projects. This is not one project, it's projects working together with different funding mechanisms, and the majority of that was from USAID. But in 2018, we were able to submit a fully worked out proposal for the Ministry of Health and the Ministry of Labour about how they could restructure their workforce with associated academic restructure to professionalise it. Unfortunately, there was an election, there was a change of priority, and this particular dossier that I call it is sort of stuck in the system. So I point that out because a couple of things. One is that changing workforce systems in organisations, particularly in governments, takes a long time. And what is often hard to overcome is the frustrations that political change can have, particularly in government entities. And so that also comes back to challenge our thinking, and this you would have heard if you went to the stewardship session, is about what is the best way to run health supply chains in countries. But this, again, was a really interesting. What was exciting for us from the case study is we've learned a number of things, and we're now looking to apply this thinking in Rwanda, Pakistan, and also in Zambia, where there's this recognition that we need to reorganise human resources systems in order to improve professionalisation. One of the key points from those on the screen is the role of advocacy. One of the things I don't think we do well as a supply chain community in development is to engage with the ministry and also not just health, financing and planning for the role of supply chain and its importance in health in our sector particularly. So if you can imagine the Minister of Health has 13 manila folders on her or his desk of priority. Which manila folder has the supply chain information in it? The one at the bottom. How do we elevate that manila folder to take action? And then when that manila folder is opened and we are discussing issues of supply chain strategy and design, where is the workforce development priority in that discussion? Warehouse comes quick, buying products comes quick, LMIS systems come quick. Yeah, maybe we can look at workforce development a little bit later. And we need to be looking at these cross-sectionally in order to strengthen overall systems. So I'm leaving some time for some questions, but I just want to emphasize a couple of key points. One is that everyone in this room should be concerned that 1 in 3 people in this world do not have access to medicines that can save their lives and reduce mortality. I would challenge you to think about wherever you're working, what you're doing, what's your role in that? I've presented to you our project as as a significant USAID project that's looking at this, but I also want to acknowledge that at this point in time, I've been in this area now for quite a number of years, and I've never seen so much interest, development, and funding, and so it's a great opportunity. What I've showed to you today is a couple of tools. One is the theory of change for human resources management, a people that deliver tool that allows you to systematically look at how to make a productive workforce. This is available, can be applied, and we can be using that to not only advocate, but look to improve systems. On the other hand, I've introduced to you some new thinking that I'd like to challenge you to consider the relevance in your country context about thinking of the human resources marketplace for supply chain professionals as an ecosystem. Can you analyze that system, and what strengths and weaknesses can you identify? What opportunities for catalytic investment that would grow the whole profession? This needs to be done systematically if we're going to make particular change. I've had the pleasure in sharing with you a couple of case studies from countries that we work in, particularly led by a number of colleagues. And I want to thank you so much for listening and invite you to have a discussion together over the next 10 minutes. Thank you.
Thank you very much, Andrew. Are there any questions? No? Can I ask a question?
Sure, start the ball.
You've mentioned the word ecosystem quite frequently. And my question is, I think as we all know, what happens in ecosystems? If you change one part of it, there's an impact or consequence further down the line. So what do you do to make sure what you're doing at this end of the ecosystem doesn't impact negatively on another part of it?
Sure. The other part of understanding ecosystem is that there are a number of components need to be working in harmony for that ecosystem to be functional. Yeah. So in this situation, if you remember the screen with the bubbles from Rwanda, the first part is understanding the stakeholders and bringing those stakeholders together on the journey. So from our work in Rwanda, it's mapping those different elements. I use the term system actors and functional actors, both in supply and demand, understanding what their needs are and then taking them on a journey together around this professionalization approach.
Okay, great. Thank you.
Yeah.
Anything? Oh, here we are. I'm coming.
Thank you, Andrew. I'm David Crew-Brown. Yeah, just a question around the time it takes to implement. I think you've often said, 8 years, 4 years, 6 years. With the work that you guys have done till now, do you think going forward in some of these countries we'll be able to see that time shortened? Because it just feels that it's such a travesty that it takes so long to get to some of these points of being able to drive significant improvement. I think we've heard through the conference a lot about technology leapfrogging, people leapfrogging. Are there opportunities to start doing that, to start getting this development in people going faster?
Sure. So the range of technologies are available to leapfrog the development of competence. So that's skills pathway. The areas that take the time is adjusting the policy environment to be actually employing the right people. So having the job description with the request for the right qualifications. It also takes time to build capacity in academic institutions. So one of the things that we're currently talking with USAID about as part of our next round of investments is what's our role in advocating and getting the people together to understand we need to move more quickly, and how can we bring the policymakers together to make that happen more quickly, to, I suppose, catalyse that environment for a speed of change. So we're currently looking at that. Probably the priority area we're looking at is that of advocacy and getting the right people in the room to make that change happen.
Anything? Oh, right at the back. You just wanted to see me move, didn't you?
Thanks. Hi, Andrew. Craig Oswald. As you're talking about this training, we're all aware of lots of training going on in all the countries simultaneously for different reasons. Is there any cohort that's trying to collect this training and understand to try and synchronize, maybe sequence, maybe build on each other?
Sure. No, thank you. That's a great comment. There's no shortage of people doing courses. And one of the things we don't do in our project is we don't develop supply chain courses at that central level. We try and work with local institutions to grow in their environment. The overall philosophy I would encourage people to consider is take a needs-based approach to education. What are the competencies required in your context, and what are the education approaches that are meaningful in your environment in order to make that change? One of the key activities we're working on at the moment is I mentioned this marketplace, say in Rwanda. And one of the key steps that we feel is important is to actually map the competencies required of these different levels of cadres in the system and have the stakeholders agree on what they are for that context, and then work with local institutions to decide, well, what is the relevant education to match those competencies so that the supply and demand sides are working together. So for that to happen, there needs to be competency frameworks, and there needs to be a professional framework that encourages everyone to work around that same environment if you want to make that in an ecosystem. If you want to do that as an organisation, then I would encourage organisations to think about what are the competencies they're trying to improve and what is the education that will help with those particular competencies. Because education is not standardised, and there are a lot of entities providing different supply chain education. You need to look what's under the hood. Do you have hoods in America? The car has a front and a hood? The bonnet. Look under the bonnet and see what's in the training to see if it matches your circumstance. But there's no overall mapping program that's occurring.
Okay. All right. With that, I'd like to say thank you very much to Andrew for spending time with us.
No, you're welcome.